In this week's muscle breakdown, I'm not going to be covering a specific muscle. I'm going to be covering something really important, the disc. The disc in the neck. It can really mimic a lot of problems that we're not picking up in our evaluations, in our treatments. It can cause a lot of problems. So in this video, I'm going to break down a disc injury, what to look for, how to find it, and most importantly, how to know if it's in there and how to fix it. Well, what's up, everybody? Dr. Matt Madger here, creator of the Peak Method, founder of the Soft Tissue Revolution, where we show massage therapists a new method to allow them to easily double their income, all while working 50% less. In this week's breakdown, I'm going to be covering something that commonly gets missed by, I would say, the majority of practitioners out there, even chiropractors, physical therapists, and definitely massage therapists, and that's a disc injury. So disc injuries are becoming more and more common, especially with our sedentary postures, sitting a lot, looking down, not moving how we should, and it really beats up a lot of areas in the neck, especially. So I want to cover more of a disc injury in the neck this week. So I call the disc problem the great mimicker of so many other problems out there, and a lot of times people miss them. So one thing that I always teach in my training is there's 7 problems in the human body as we go through and try to figure out what they are. That's it, only 7 problems. And if you want access to that training, it's down in the information below in any of our profiles. But those 7 problems are bone, cartilage, disc, ligament, nerve entrapment, soft tissue, and tendon. That's it. Now, discs are very important. And a lot of times what happens to the disc in the neck is it's basically a shock absorber for the neck. So the disc is really designed to handle force like this all day long. But over time, what happens is, like I said, with bad postures, maybe some trauma, lack of movement, all the muscles around there, they don't function how they should. They actually overfunction and they tighten up in this protective way. And when they tighten up, it causes the body to release what's called chemotaxis. I'm not going to try to get all fancy on this, but basically what happens is there's not enough blood and oxygen to the area, so the body sends a signal to the brain that there's a problem in there, and the body starts to lay down scar tissue. So that scar tissue makes that muscle weaker, less flexible. But what it does is it actually puts more pressure back down on the disc and the joint in the neck. And now instead of your disc going like this, it starts to slide and grind on itself. So a lot of times when people come in for disc injuries, they'll come in and say, hey, I just felt like I woke up and I couldn't turn my head. Or they get a lot of pain like deep in the shoulder blade. Or if they sit for too long, it really gets flared up. Or like I said, they just can't turn their head. And that causes a lot of things. So a lot of times what happens is we get really focused in like where it hurts, especially like deep in the shoulder blade. And when people come in and complain of like a dull, achy, throbbing, even like a stabbing type of pain in the shoulder blade, it's not a upper trap problem, it's not a levator problem, it's not a rhomboid problem, it's actually a referral of some of those discs in there as well. And discs are really important to know that you have them. So a lot of massage therapists come back and say, well, I'm not allowed to treat discs and those are left for the surgeon. And that's complete nonsense, because basically you have to know what's wrong with the client, because a lot of things what happens with disc injuries is if you know they're in there, you can actually manage that client's load in between. So I always say, think of your disc that's damaged as your thumb and it's stuck inside a car door. The car door is all that scar tissue. You can't give this a chance to heal till you remove that. So knowing that a disc injury is in there, knowing how to tell the client what to do and not to do, and then getting in there and being able to figure out what tissues are actually putting pressure on that can make or break your treatment. So what I want to include this week is a test that we end up doing in my clinic to help really decide if that disc injury is going on there. So I'm going to include that video. Take a look at that. It'll really help you get a better idea of like what structures are putting pressure on that disc and causing that problem. So we're going to do our cervical functional test. The first one is going to be the cervical functional test to see if there's a disc injury. So with this one, we wear the glasses because they're going to help us give some baseline and some measurements for that. And you're going to have the client right up against the wall. And what you want to do is have their heels against the wall, their butt against the wall, and in through that. And their head is going to be up just like this. So the first test we're going to do is we're going to see how these upper cervical muscles are functioning. And we're also going to see if there's a disc injury in there as well. So what we do is we tuck their chin back. And this is going to be a weird motion for the client, so you got to take them through a few times. And what you're going to tell them is we're going to be sliding your head up the wall and tucking your chin. So we're gonna tuck the chin and slide the head up the wall. It's a little bit of a strange motion, so you gotta kind of coach them through that. I'll give a couple cues of like, tuck your chin and slide your head. Good. So then we're gonna do that test, and this is gonna be one where we're gonna get in there and ask them what they feel. So come out of that test, you're always gonna ask them, where do you feel the pain? What does that pain feel like? And how intense that is. And a lot of times when the disc is very inflamed and is causing problems, they're gonna get a lot of dysfunction back through here, some pain down into the shoulder blade, down into the arms, and they just will like almost have this face of like impending doom where it's very uncomfortable. And when you see that, it's gonna let you know that there are some disc injuries in there, and you're gonna have to go first and decompress that disc and unload that. So what I always want you to do on this first test is once you get that, you're gonna come in and you see that, you're gonna take a video of them doing that a few times, because it's gonna be really good data to show the client before and after as that gets better. So on this first test, if you're just checking for the disc, I want you to take a video. So the first flow in the cervical spine is cervical disc, like to see if it actually is positive for a disc. And you saw there, you're gonna see here in the video as we go through, you're gonna take it through and you're gonna really see if there's a disc injury in there. And a lot of times you're gonna have this information before you even get started. And a lot of times for a disc injury, a couple of the questions are gonna be really important, are gonna be like severity. And a lot of times when people have a bad disc injury, a lot of times they're getting like that 6, 7, 8, 9 out of 10 for pain. Symptom location as well, they're going to get a lot of pain back here through the shoulder blade. They might even get some stuff down through the arm. And that type of pain, you know, the quality that we talked about is going to be like that sharp, stabbing, like shooting type of pain. A lot of times in the history when you're talking to them, they might have a history where they wake up and they can't turn their head at all for days at a time. But those are the data that you're going to know. So the beauty of how you do the system and how the peak method works is you've already collected all this data before you even go into do the test. So you have like an idea of what's going on, but now you're going to look at the tests, and the tests are going to really give you data objectively to know what's going on. So a lot of times when the disc is flared up, you want to take the video, as we talked about. The video is going to really show them like that they're limited, and this people will make like this wincing face as they go through, and a lot of times that can cause some issues for them because there's a disc problem going on. But if we don't get the disc to decompress, I always say think of your disc as like your thumb and it's stuck in a car door. The car door is all this scar tissue, so we can't give this disc a chance to heal up if we don't remove all that scar tissue, and that's what you're gonna see first. But we gotta decompress, because the cervical flow, as we talked about, if you don't follow the flow, you don't clean this up and you just start where it hurts, it's not going to hold. So we got to get that thumb out of that car door, and that's what's going to start with decompressing and getting in there to open it up. And the best way to decompress that is you're going to be treating the nuchal ligament and you're going to be treating the levators, and then as you get better, you're going to get into these nerve roots and go in through there. But what you're going to see in each of these videos is we're going to get a real advanced palpation about how to find them, what the test looks like, what kind of data you're looking for, and put it all together. But the first step in the cervical flow is you have to decompress the disc, and you have to do it for multiple visits. I'm usually treating this for at least 2 or 3 visits to kind of decompress it, because a lot of times people have such bad disc and we got to get all that pressure off of there. So start here and then work your way down. So I hope you enjoyed that video. If you want any more access to those type of videos and those trainings, we always are taking on new people in our program called the Peak Method. All that information is listed below. But knowing that you have a disc injury in there is going to be really important. And this gets missed by so many people. And when you can become that person that actually figures out what's going on with your client, and you have the tools to get in there and fix it, you're going to be in a whole different echelon of everyone else out there. I always say you're either a service provider or you're a solutions provider, and solution providers get paid 10 times more, and they deserve to get paid 10 times more because they're solving people's problems. So disc injuries are a big issue, and you have to be able to look out for them, know what to ask, know where that problem is, and more importantly, be able to do a functional test to know that that problem's in there. So I hope this video helped. If you ever have any other videos or any muscles or ligaments or joints or even nerves that you want me to cover, send me a message and I'll add it to my queue. I'm always here to help. If you enjoyed this video, give it a like, a comment, or share. And if you like this content, subscribe to us on YouTube. Send me a message if you're watching this on LinkedIn, or go through everything and, find out more about our unique and revolutionary treatment method called the Peak Method, so you can get on the path to actually being taken serious as a healthcare provider and start solving people's problems. Appreciate you guys watching, and I'll see you in the next one. Bye.